Alright, so let's talk Module 6. Yes, I did skip Module 5, but we will go back to that. That'll be the next module we do. Module 6, we're going to talk about age-appropriate care. The objectives are to describe the normal growth and development of infants to preschoolers, identify developmental tasks of middle childhood to adolescence, and identify developmental tasks of the varying stages of adulthood, identify physical, psychological, and social effects of aging, and describe methods in which you can ensure age-appropriate care. So let's talk about growth and development. What is growth? As a home care aide, you will care for people of all ages and of all health statuses. It's important to have a basic understanding of growth and developmental milestones and those tasks which in turn allow for better care of the patient. When we discuss growth, we're referring to the physical changes in a patient. For the most part, unless impaired or with a specific disability, people grow in a steady manner. We measure growth by factors such as height and weight. When we talk about development, we're referring to the psychological and or social functioning that a person has. As we age, we learn how to relate to the world in different ways. For example, a toddler has a simple view of the world and looks to a primary caregiver for most of his or her needs. However, an adult can meet his or her own needs and is able to think complexly. Conversely to that, you could have an adult who has the mentality of a child. So, birth to 1 year old is infancy. This is a time of rapid learning and growth. In this year, developmental tasks include sitting up unsupported, crawling, some babies walk, some don't, developing feeding and sleeping patterns, eating solid foods about 5 or 6 months old, beginning to say some words and communicating verbally or with gestures with others, developing emotional attachments to family members and to caregivers. After birth, infants wake to eat, which is eating means formula or breastfeeding, and they do a great deal of sleeping in between meals. However, as infants age and grow, their periods of awake times will increase. At the same time, their interactions with others increase as they begin to learn about the world around them. Infants must learn to master their body movements. When they're born, they're uncoordinated, and most of their movements early on are involuntary. As the central nervous system develops, they develop muscle coordination and move their bodies purposefully. Their behavior goes from reflexive to purposeful. Safety issues with this age group relate to the activities that the infant is learning and respiratory issues, such as sudden infant death. An infant needs to be protected from rolling off a bed or a table. Infants can move quickly and should not be left outside a crib unattended at any time. Infants learn about mouthing objects. Nothing that can fit through a toilet tissue roll should be within the infant's reach. Your airway is the size of a toilet tissue roll. Things that are smaller than that could be swallowed and lead to respiratory difficulty. As the infant becomes more mobile, safety measures need to be taken around the home. Those being gates at stairs, sharp corners covered, electrical outlets covered. It's important to remember that an infant's primary caregiver is the center of their world, be that their mom, their grandmom, an adopted parent. The infant will learn best from his or her primary caregiver. Therefore, the caregiver should be involved in their care along with the home care aide if we are giving care to an infant. Toddlerhood is 1 to 3 years old. Physical growth is now at a slower rate. Some developmental tasks include mastering walking, learning to separate from the primary caregiver. This is why 2-year-olds cry when their mommy walks away. Learning about bowel and bladder function. This is potty training years. Every mother hated it. Using words more than gestures to communicate, gaining some independence from their primary caregiver. This can be expressed as a child trying to do more on his or her own and having a temper tantrum as a way of objecting. As toddlers become more mobile, their curiosity grows, They're interested in everything around them. They want to touch, feel, grab, or hold anything that's of interest. This is how they learn about their environment. Potty time. Toddlers may also start toilet or potty training during this time period. They must be both physically and psychologically ready to start and should not be forced into potty training. Staying dry through the night may not come at the same time as daytime toilet training. This was something Miss Aish, most of you know her, was having a hard time with her son. During toddlerhood, the word no is a normal response to everything. This is a child's way of asserting him or herself and learning boundaries and independence. Toddlers will also start having more dreams now and may have nightmares. Although once awake, they may not remember what scared them. They need to be watched closely. They continue at this age to put things in their mouth and explore and become more brave. They often wander off from their parents and need to be protected from being lost. Toddlers can also be very clumsy, and safety should still be a main issue. The reason that they're clumsy, if you look at the body in contrast to the head is still really big and their bodies are still really little. Playing and simple instructions can be used to teach toddlers to gain their trust. Oftentimes you have to repeat instructions to toddlers. Preschoolers, 3 to 6 years old. Preschoolers grow in height, but not as much in weight. Developmental tasks include developing and understanding family relationships, learning rules and consequences, increasing vocabulary and communication skills, performing more self-care activities like feeding themselves and brushing their teeth, even though they may not do it well, understanding differences in genders, the difference between boys and girls. Usually it doesn't happen till about 6 when kids become modest. And they don't want to, girls don't want to go potty with the boy, and the boy doesn't want the girl to see him. So they also at this time learn to play with others instead of just next to somebody. So they actually start to fight over toys, and they want to play together. Learning rules will be a big task for a preschooler. The child will learn rules at home, and by the end of this period will be kindergarten. There will be a new set of rules, and those will be introduced in kindergarten. At 3 1/2, the preschoolers should be able to balance, recognize colors, button buttons, and follow simple instructions. Preschoolers are developing their sense of right and wrong, and they need lots of encouragement and explanation as they develop a sense of adequacy in their abilities. Their confidence development can affect children into adulthood. So if you're constantly telling a 3 to 6-year-old that they're not doing something right, and you're always negative, you actually build that into their genetic being as they grow. Some of you can probably relate to that. Preschoolers need to be watched closely for safety. They continue to be very active and sometimes lack the ability to see possible consequences of dangerous behaviors. This is the time frame when all little boys want to be Superman, and they think that they can climb bookcases and they try to fly. Middle childhood is about 6 to 8 years old. This is the time for school to really start for a child. Developmental tasks at this age include learning about peer groups, learning school materials such as reading, writing, and math, developing better social skills as well as playing games and sports, be it winning or losing, learning appropriate behaviors and manners for different settings. So the way you behave at home may be different than the way you behave at grandma versus the way you behave at school. Developing positive feelings about oneself, developing empathy skills, and gaining a conscience for the things that you do. Control gross motor skills are practiced during this age group, like bike riding, playing sports like t-ball or softball, and games like Monopoly, things like that. Middle childhood is a time of developing problem-solving skills. This age group will have lots of questions and will need accurate and truthful answers and encouragement. They have a variety of coping skills, including denial and regression, nail biting, dependence, humor, and fantasy. This is when most kids actually get their imaginary friends. To teach this age of children, you have to use play, simple instructions, repetition, books, and give examples. Late childhood, believe it or not, is considered 9 to 12 years old. This period is also called pre-adolescent. Developmental tasks carry over from middle childhood, except there is now an expectation of maturity with certain behaviors. Developmental tasks include gaining more independence from adults, understanding ethics and morals, developing lasting friendships with your peers, understanding the roles of one's gender, developing school skills. So if you think about it, this is middle school years for you guys when you started to make your friends. And if you moved away from your friends in middle school, you actually miss them. And most of you can think back and remember your best friend in middle school. During this time frame, as well as developing muscle strength, coordination, and balance will be strengthened as well. Fine motor skills are developed and will closely resemble those of an adult. Peer groups will start to become important, and children should be supported as they try to fit in. When I was growing up, this was the preppy group. You always wanted to be part of them versus the thug group. At school, children develop their own learning style, and caregivers should try to help the child learn within their own learning style. That goes back to that patient-centered care. Adolescence is from 12 to 18 years old, and puberty begins at this time. It's major physical and psychological and social growth. Boys and girls go through puberty at different times. Often with girls, it's between the ages of 10 to 14, and boys, the ages of 12 to 16. It's usually an awkward stage as we go through puberty. Developmental tasks for this age group include adjusting to and accepting changes in one's body. Exercising is increased independence from adults. Developing relationship with peers from the opposite sex and from the same sex. Learning how to function in society, including learning attitudes, values, beliefs, ethics of one's culture. If you think about it, this is the time frame that you actually realize that boys are cute and that girls are cute. Okay? Girls and boys go through different changes during puberty. For girls, menstruation will begin and secondary sex characteristics develop. Changes in breast size, voice slightly changes, and body hair begins to grow in the pubic area and underarms. And for girls, your hips actually start to widen. For boys, nocturnal emissions may occur. While sleeping, a boy's penis will become erect and oftentimes release semen. And other secondary sex characteristics also develop, such as facial hair. Body hair will grow in the pubic area, underarms, as well as increased hair on arms, chest, and legs. Boys' voices begin to deepen, and the shoulders and the neck begin to increase in size. This is a time of major change. Emotions run high during this period. Sadness and depression can be common as one learns to deal with the changes around themselves and within their own bodies. A lot of times this is hormonally based. Girls, your estrogen levels increase, and boys, your testosterone levels start to increase. At this age, a person is developing a sense of individuality, but can be greatly influenced by others. Peer pressure during this time frame, as you guys all know, is very intense. It can lead to experimentation in a variety of things such as drugs, alcohol, reckless driving, and reckless sexual behaviors. Consequently, teens need accurate information on smoking, drugs, alcohol, birth control, and sexually transmitted diseases. We talked about this a little bit in the very beginning of class. You need to be more than told not to do something. You need to know why you shouldn't do it and why you're making the decisions for yourselves and not your primary caregiver. This is the time when your parents tell you not to do something and you always want to know why, because you're experimenting in your life. This is lots of times when you guys can get into trouble. So during that time frame, privacy is of the utmost importance to the teenager, and everything should be done to protect that. Teens need a lot of information during this time and will need support as you make decisions for yourselves. So when I was growing up, I'm now 46 years old. My mother still hasn't had the talk with me. So you have to be an interactive part of your need for knowledge, asking appropriate questions at appropriate times of appropriate people. Some people don't want to have those discussions with you because they don't know how to answer your questions. So you also have to be very active if you're caring for somebody of this age, when you guys are a little bit older and you're practicing in medicine, to remember how it felt to be a kid of 12 to 18. So young adulthood is from age 18 to 40. Haha, I like to think I'm just barely outside of young adulthood. While physical growth slows down, psychological and social growth continues. Developmental tasks include deciding on educational goals and an occupation, changing jobs and learning about yourself, dating someone seriously and possibly marrying them, learning to live with roommates or a spouse, having and raising children, developing and maintaining a fulfilling, intimate relationship. Many different types of life changes occur in young adulthood. Maturity levels definitely increase as the young adult ages and experiences life. Those in this age group will begin to experiment with career choices and adult behavior. It's important not to treat the young adult like a child. Developing a personal identity and achieving independence from caregivers is a major goal at this time. Developmental crises may arise as the young adult establishes a career, a home, intimate relationships, and a family. Young adults may struggle with anxiety and depression. Safety is typically related to lifestyle habits, such as drug or alcohol use, sexuality, family planning, and substance abuse. Young adults may use coping skills such as denial, humor, anger, drugs, alcohol, music, meditation, TV, or social contacts during this time frame. Middle adulthood is from 40 to 65. Developmental tasks in this time frame include learning and adjusting to new physical changes, vision and hearing changes, lessened endurance, slower metabolism, which means you gain weight, impossible diseases or conditions, dealing with grown children and aging parents, nearing the end of one's career, and choosing leisure activities. Health concerns begin to reflect unhealthy lifestyles. Healthcare needs are related to the prevention of chronic disease and health promotion. Cardiovascular disease is the major threat to this age group. Heart attacks and strokes are the major cause of death among this age group for both sexes. Safety continues to be related to lifestyle, family planning, and substance abuse. Sexual dysfunction can be a healthcare need of men, and menopause also occurs in this time frame for women. Menopause is when a woman's menstruation stops. This is typically a gradual process and can be very emotional for a woman to go through. Menopause can be emotional due to hormonal changes, but it also marks the end of a woman's ability to have children. Late adulthood is 65 years or older. People in this stage are referred to as elderly. Developmental tasks include losing strength and adjusting to physical and health issues, retiring and learning to live on a reduced income. You will need to know that. Adjusting to the death of loved ones, friends, spouses, children maybe. Possibly moving to an elderly community or facility and making new friends. Imagine leaving your home that you've had for 20 years and moving somewhere where all you have is a room. Possibly thinking about one's own life and death and making plans for such. Health issues may dominate this age group. However, elderly adults can find new hobbies and activities that they are able to do. Many will volunteer and try to stay busy and productive. In one's elderly years, some physical changes are gradual loss of subcutaneous fat and elastin. That's why we get saggy. A 1% decrease in brain cells per year after the age of 50. That is, if you haven't smoked them out, so to speak. A 30% decrease in the heart's efficiency between the ages of 30 and 75. A 40% decrease in the lungs' efficiency between the ages of 30 and 75. A 50% decrease in renal function, that's the kidneys, between the ages of 40 and 90. A 50% decrease in the bladder size. A 10% decrease in liver efficiency with age. Your liver is actually one of your body's filters. Also of possible concern are increased risk of injury related to falls, increased risk of respiratory diseases, and increased risk of infections related to the weakening of the immune system. So if you think about it, when you were an early adult, if you were a smoker, you've already damaged your lungs. So if your lung function is already at 20% damage, and then as you age, you decrease it by 40 more. Think about that, just from smoking. Elderly patients who are mainly bedbound should be checked on for skin breakdown. So when we care for somebody, we have to care for the entire person, and we have to think about all the effects of just aging. So when you're caring for somebody, you actually end up having to do what's called age competencies, so that when you provide care, you're providing that care based upon the person's age, but that also goes to their ability to understand. All right, so now you know how we're going to take care of everybody all the time depending on their age. A couple of activities we're actually going to do, which we'll talk about the varying stages of development. Have a good night, you guys.